what we are calling COVID injections, vaccines, are actually not a vaccine. From a medical perspective, this is actually a man-made virus. And when this thing goes into your cells, it takes over your cell and it produces the spike proteins, which were the same things that were causing disease and were killing people in COVID-19.
Where is the correlation when it comes to infertility, miscarriages, early menopause?
80% or thereabouts of women who were pregnant within the first 3 months actually lost their pregnancies. And we had WHO recommend those injections to pregnant women. I don't know whether it is by coincidence that almost everything that is being offered on large scale for the new diseases always seem to affect fertility.
There seems to be a group of people who want to discredit you so much. Some people have even written articles that you are misinforming people. Why do you think that's happening?
There are two terms that are generally used. One is anti-vaxxer and the other one is conspiracy theorists. And those two terms are terms of an oppressor. Anytime somebody doesn't want you to express yourself, there is something they're trying to hide.
Hey guys, welcome to today's episode of LNS. My name is Lynn Ngugi, and once again, I cannot thank you for your feedback on our thought-provoking conversations, because I know, guys, we have to be able to do this collectively, and I love the feedback that we are getting on the many episodes that we are airing on our platform. Now, the UN has projected that by 2050, Africa's population will double to almost 2.5 billion, which simply means Africans or CC Africans, we will occupy maybe 25% of the world's population. But why is it that there is a sudden conversation on depopulation of Africa? My guest today has put his reputation on risk. He even told me, hey, Lynn, I don't think anyone wants to see me. But guys, when you hear the truth he has to offer, you will listen, you will take notes, you will learn, you will unlearn, and you will relearn, because I believe that's the purpose of the conversations that we are having. I'm about to let him introduce himself so that he can be able to walk us through this conversation in a very layman's language. But before I do that, I want to say thank you to each and every one of you for getting us to over 1 million subscribers. I do not take you for granted. Shukran sana. And also to say thank you to my team for making this happen. You know what we say, you get to see me in front of this camera, but it takes an entire team to put this work together. So shukran sana. And always I've said, if you are not able to put your comments on the comment section, always feel free to reach me via info@lnn.digital in case you want to tell me something in private. And of course, now without further ado, please allow me to let my guest today introduce himself. Sir, how are you?
I'm very well.
Karibu sana.
Thank you very much.
How are you feeling?
I am very well and grateful to be here. Yes.
It's a good day to be alive.
Yes, it is.
All right. For people who are maybe tuning in for the very first time, could you please introduce yourself?
Yes. Good morning, good evening, good afternoon, wherever you're listening from. My name is Dr.Wahome. I am a child of God. And I am a Christian of Gikuyu extraction. I am the son of Ngare and Gathoni.
Yes.
I am married and I have 3 lovely children, and I have 2 grandchildren. And I'm happy to be here. By training, I'm a gynecologist. I've been practicing from as a medical doctor from the year 1991 is when we graduated. And as a specialist, I graduated in the 2000. Yes.
Or you've been very vocal about some of the topics that we are going to touch on.
Yes.
But one of the things I love hearing and one of the things I love saying is a lie can take care of the present, but it has no future.
Yes.
According to you, what's the biggest lie we've been told about Africa's population?
The greatest lie we've been told is that Africa is overpopulated. And it is a lie that stems far back. The theory of overpopulation is an old one. But it was formalized when the UNFPA was put together in 1968. And its basic structure was the concern of overpopulation and therefore the need to reduce world population. That's 68. And then in Cairo in 1994, during the ICPD conference, again, it was an issue of overpopulation. And the world is overpopulated. Now we need to bring in what was called reproductive health.
Yes.
The concern about how many children people are bearing and its relationship to development. So that's the first time population and development are being put together. And even aid was going to be tied to development. And when we came to 2012, the SDGs, again, something was introduced called sexual reproductive health and rights. And that again has a lot to do with reduction in population. And now we have climate change. And the whole idea again is the problem with climate is because of overpopulation. So there's been this constant push about reducing population. But if you take the landmass in Africa, just as it is as a landmass, you can actually place the whole of the United States of America. You can place the whole of the China on the subcontinent. You can place the whole of Europe, the whole of Eastern Europe, and Japan, and India. And you can even fit the UK over Madagascar, right? If you look at the total population in these continents, subcontinents, that can fit on Africa, it totals to about 4.1 billion. And the current estimated population of Africa is just 1.2 billion.
Yes.
So you see, Africa can feed itself, Africa can feed the whole world. The problem has never been overpopulation. But Africa is sitting on a lot of mineral resources. It has one of the largest mass of land that you can cultivate. And this makes a few greedy people want to take that. And that is where the problem is. The problem of Africa is that the resources it is sitting on are such that if you decide to use resources as Africa, they may not be available to the other countries in Europe, and especially to the corporates that are using these resources to generate wealth.
All right. We've seen even our president advocate for labor export, which means we have great energetic youths in our own country. But also we've seen billionaires who have termed this growth, this population growth, as a liability, or they said maybe an asset or a liability. Why do you think there is a focus for, when it comes to our youths, why do you think there is a key focus to term them as a liability?
Well, Africa is the only continent with a growing population. Most of the other continents, the populations have started going down. Europe and some areas of South America have below self-replacement rates. Okay, so if you are worried about competition for resources, especially when you want to own them as opposed to sharing them, then Africa becomes a major challenge, because that's where the largest growth is. And yet that is where the minerals and other riches that people want to own are. Now, you can look at population either way. You can look at population as a liability, which is how the West looks at the African population. And maybe we should be clear that it is not necessarily the West as a people, but the UN agencies and whoever funds the UN agencies and whatever their interests are. So if we have many children being born in Africa, and Africa is young, is 18, 19, it is a question of taking these young people, empowering them, and helping them to use their natural talents and education to develop the continent. We are not as far developed as others.
Yes.
And therefore, with a young, educated population, if we put our resources, our taxes towards enabling the young people to use their talent to grow the continent, then they are an asset. But for someone who wants to appropriate African wealth, then they are competition. So think about it this way. If you were born in a family with a big piece of land, right? And one of your uncles has only 2 children, and your father has 11. One of the challenges would be that in case there is need to divide this land, the bigger family may get a bigger piece of land, isn't it? So the guy with a few children might want your father to also have few children. But you see, it is greed.
Yes.
It is not that there is much, there is nothing to share. And you see, Africa has always grown around the Ubuntu spirit. You see, in my language, Omodo, Ubuntu just means I am because we are. It means that my value in the community is only in service to others. It means that I can only enjoy my freedom if I protect your freedom. I can only enjoy my sovereignty if I protect your sovereignty. So that Africa has never been mean with its resources. We have always looked after the people who come and visit us. And that's part of the reason why we lost land so easily to the colonizers. Africans are basically generous people.
Yes.
So we do not mind feeding Europe, and we do not mind feeding anybody else who is in need. What we have a problem with is somebody who doesn't want us to develop Africa for our own benefit and for the benefit of others, just so that they can remain wealthy.
All right.
Yeah.
And to remain wealthy, they will, because they've set mechanisms in place to be able to depopulate Africa, a term you often use when you're having conversations. But before we get there, there seems to be a group of people who want to discredit you so much. Some people have even written articles that you are misinforming people. Why do you think that's happening?
Well, there are 2 terms that are generally used. One is anti-vaxxer, and the other one is conspiracy theorists. And those 2 terms are terms of an oppressor. Anytime somebody doesn't want you to express yourself, there is something they're trying to hide. Because if you have nothing to hide, you should be able to allow
Free speech.
Should be able to allow both opinions and allow the public to make a decision. I mean, Kenyans are intelligent people, Africans are intelligent people. They don't need you to tell them who is speaking the truth and who is not. All that needs to happen is allow people to express themselves and then let people make the decision. So the minute you call somebody a conspiracy theorist, the minute you call somebody an anti-vaxxer, meaning that their opinion should not be listened to, then you make yourself a little god who has the right to say who should speak and who should not speak, and who decides what is truth. How would you dare decide what is true? That's the problem with those things. So those are terms that are used by the oppressor. Now, when we speak the truth, because I'm associated with the Kenya Catholic Doctors Association, I'm the current chairman. There is an organization we've launched called the African Sovereignty Coalition, the Kenyan chapter. And these organizations stand for the truth. and they stand for the sovereignty and independence of the people of Africa, independent thought. And even as a doctor in my training, do you know, Lynn, that I cannot love you enough to force you to take treatment? That if I have a patient who is very sick and I know exactly which medicine to give them, or which drug they should take, or which surgery I should do, and I tell that patient, this is what we need to get you back to good health, and the patient looks at me and says, doctor, I don't want your treatment. Do you know ethics do not allow me to treat that patient? Now, if that is how my training background is, then I have a problem when you come and prescribe a certain treatment and insist it is the only one that people can take. That is what puts us into a lot of conflict with the people who benefit from the medical industry. So health has been politicized and it has been commercialized, so that if I make a product and I know I can sell it, then the person who stands in my space then becomes an enemy. Yeah, so that's really the genesis, is about hiding the truth. And for you to be fair, I think the best thing is to allow people to hear the truth. There will be people who will tell lies. There will be people who will tell the truth. But people are intelligent enough to determine
For themselves.
For themselves.
All right, let's go to your version
Yes.
of the truth. And I'm saying your version of the truth because you have admitted people have the freedom of choosing what their truth is. Walk me through why they call you an anti-vaxxer. Because number one, when I was getting my vaccines, or when my mom would take us to get vaccinated, I don't honestly believe people know what they are going to be vaccinated against. So you would hear kuna ya polio, kuna tetanus, peleka mtoto hapa na hapa. So could you walk us through, in a very layman's language, what are vaccines? Why do we need vaccines? What do you advocate for, and what are you against?
Okay, so I'll try and use language that is simple enough.
Please.
One, you can't understand vaccines unless you first understand the way the body protects itself, immunity. And after you understand immunity, then one would need to understand a virus, because those are most of the vaccines would be against viruses. So, Lynn, the vaccines would be maybe about, the form of vaccines might be about 300 years old. The first time the technology is used to prevent infection. But humanity has been in existence for hundreds to thousands of years. How come we were alive until 300 years ago? It's because the way our body is designed by God, it is designed to protect us from infection. So there is no sterile environment. Even in this room, there are bacteria and viruses all around us. And every day you take in this stuff. How come you don't get sick each time? It is because you have an immune system that is protective. And the immune system is divided into two. There is what we call the innate immunity, and then there is what is called the adaptive immunity. The innate immunity is how your body will respond to any infection before it has trained itself to deal with a specific issue. And the easiest way to understand it is, first, there is physical protection. So if I'm in theater and I'm operating on a patient who has HIV, and my gloves get torn maybe by some of the instruments, and I have blood on my hands, I would just need to change my gloves, wash off the blood, and continue the surgery, and I don't need to take any antiviral. Why? Because HIV cannot go through intact skin. But if I was to inject myself, if I was to cut myself with a needle or with a blade, and now I have broken skin, then there is risk that the contaminated blood has gone beyond the skin and can cause disease, and I'd have to take some medication. So our skin is protective. Now, those areas of the internal organs, we call the mucous membranes, like our gut, the respiratory system, the eyes, the sexual organs, have a different type of protection. And that's the mucus that usually covers them, that would trap the infective material, can disable the infective material just to prevent it from penetrating into the body. So that's the first barrier.
Yes.
The second one now is the cells that are not specialized, but would move around to pick up any stuff that is not within the body, is not part of the body. So you have cells that would destroy bacteria by just finding something that doesn't belong to the body. We have cells that would destroy an infected cell called killer cells. They would destroy cells that are becoming cancerous and destroy those. And then they would train the rest of the body system. Once they get this antigen that is not normal, they then train the second level of the immune system to develop specific actions against the infection. And that is what we call adaptive immunity.
Okay.
So at that point, it means if you ever come across that agent again, your body will be ready. And you're talking about cellular immunity and then antibodies, but then there is also memory that is retained. So like those people who were vaccinated against smallpox in the 60s, 70s, you take their blood today and check for antibodies against smallpox, it is not there. But if they get smallpox, the cells that were trained to fight it will remember and push back. That is something that the general community is not being told, that your body can fight disease on its own. That is the first point. Now, when you come to the issue of the virus, the virus is a very tiny, organism, so that the one cell of our body, so the organs are made of many different cells, okay? So one cell of the body, the virus is smaller than that. And the virus cannot multiply on its own.
Oh.
So the virus must come into the body, get into the cell, deposits its DNA. So the virus is a capsule with DNA material or RNA material, which is genetic material of the virus, gets into your cell, multiplies itself, and then it breaks out of the cell. Then now you have more particles that can infect others, okay? Now, that virus cannot survive on a dry surface. There must be some wetness. There must be moisture around it, so that if I cough or I sneeze, there will be droplets, here the heavy ones, but there will be a few very light ones we call aerosols that will float around. As soon as those droplets dry, then that's the end of the virus.
That's it?
That's it. Now, if I touch this surface, I pick up bacteria, I pick up viruses. They can't go into my body. And just soap and water is enough to destroy it. And they will not cause me disease unless I eat with my hands without cleaning them, and I then ingest these germs. So in a nutshell, that's how disease and the immunity interact. Now, when we come to the vaccine, what we are doing is taking something that can cause disease and giving it to a person who is healthy, creating a mild disease so that we train the person's immune system to be able to fight. So we use the innate immunity to stimulate the adaptive immunity. And now that person, if they get exposed to the real thing, then they will get, either they will not get infected or they'll get very mild infection.
So this is now preparation.
That is prevention.
In case.
In case.
Okay.
Now, the ethical issue here is that I am actually inducing disease in a person. So medicine is about preventing or treating disease. But this time the doctor is actually taking something that could cause infection, putting it in a healthy person so that that person can be protected against the disease in case it comes. So you see, there is an ethical question.
Yes.
Is it proper to infect somebody so that you prepare them for the disease. And that's why vaccines are not given the same way we give Panadol. And that's why vaccines are not produced for everything that you can prevent the body to fight against. They are made for specific conditions that are so dangerous that it makes sense to protect the person by taking that risk of stimulating their immunity. So you can use a live virus, you can take a virus and make it weak, or you can take parts of that virus and then create the vaccine. And then the vaccine has to be carried in something. There must be something that makes it stimulate immunity. There must be something that is used to preserve it. There are many other ingredients in the vaccine other than just what you're using to protect the disease. So from an ethical point of view, and from the Kenya Catholic Doctors Association, what we ask is just 4 questions. Is it necessary to give somebody a vaccine? Because you have understood the ethical and medical concerns. Is it necessary? So if you have a disease that can be treated, that has medicine that can treat the disease, then it doesn't make sense to take the risk of doing vaccination, because it is easier to then treat, because you're only treating those who are sick. Unfortunately, when you're doing vaccination, you inject healthy people. So if your vaccine has a problem, then you can threaten the whole community. That's why vaccines become a national security issue, because if they're not properly taken care of, and you're giving them to your whole population, and it was healthy, then you can cause a lot of damage. So is it necessary? Any disease that can be treated, it is much better to treat those who are sick. All right? Provide medication. And that is why when we talk about the malaria vaccine, for instance, and the question is, should you take a vaccine for malaria? Now, for me as a doctor, then the issue is between taking the risks of whatever side effects that a vaccine would have, because there is none that doesn't have a side effect, and giving it to all the children who are born, and providing medication in the malaria areas for malaria, and using other things to prevent malaria, which one would make more sense? Okay? And that would allow somebody to make a decision. So if a patient wants to be injected, that is the choice they would make. If a patient wants to wait and only be treated if they get sick,
that's a choice.
That's a choice they make. But I cannot love them enough to say it is mandatory that everybody must take. You get? Now, the second question we ask is whether it is safe. And when you're looking at safety, then you're looking at what we call phase 1 clinical trials. Before the drug manufacturer releases this drug, they must first do safety tests, safety studies. And you start with animals. And after you see what animals, how it responds to animals, or you do what we call in vitro using animal cells in the lab. Once you see that it is safe, then you try it in a small group of volunteers. And if you don't have any major side effects, then it is considered safe. You publish this material for doctors to read. Then you go to phase 2 clinical trials, which are about efficacy. Is it actually working according to your theory? Because in science, you're testing a theory. I say, I will give this person this, and this is the outcome I expect. But is that what happens in real life? So you do that with a slightly larger group of volunteers. And then when you see the side effects and you see that they are not many, or they're mild, then you again publish and you say, these are our findings. And doctors can read this stuff. It is only after that that you're allowed to go to phase 3, where you now go to a slightly larger population. And now this one is not selected. You remember your volunteers are very few and carefully selected. They don't have diabetes, they don't have this, they don't have that. In phase 3, now they are more, and it's general. Everybody is getting, even those who may be unwell, those who may have other issues. And again, you continue monitoring how your vaccine is happening. So this, it takes a long time to go through that. So when we hear there is a vaccine that has been made available, because you can make vaccines for many things. then those are the questions we ask. Is it necessary? And if it is not necessary, if there is treatment for this, then we find no value in the vaccine. But if it is necessary, because this disease is killing people and there is no treatment for it, then we want to see phase 1, phase 2 clinical trials, and then see that actually somebody did a study that showed this was safe and effective. Now, with that background, then we come to maybe specifics. The COVID-19 injections, all right? Lynn, do you know that the phase 1 and phase 2 clinical trials that are supposed to tell us whether it is safe and effective were produced in 2003? December is when the last paper was released. And this was released, this is 3 years after COVID. This is 2 years into the vaccination program.
2003 or 2023?
2023, sorry. Okay. 2023, yes. This is 2 to 3 years after the vaccines have already been rolled out, all right? And this is the first time we are getting to see what was seen during the phase 1 and phase 2 clinical trials. And the only reason this information was released is because somebody went to court and sued Pfizer in the US. And they were forced by the court to release this documentation. It was so voluminous that it took so many specialists to work on volunteer basis to be able to make sense of that material, okay? Now, it showed that there were many challenges during the time of the trials, that people died, that people were injured, that the young people were getting myocarditis. The same things we are seeing today caused by the vaccine, the injection that people are being given.
Yes.
What that tells me as a doctor is very simple, that as doctors we let the world down because we shouldn't have given any support for that injection without seeing the phase 1 and phase 2 clinical trial results. Because when I tell you as my client, it is good to take the vaccine, then what did I use?
What informs?
What informed that decision for me as a doctor? And if I haven't seen that information and I say, don't take the vaccine, don't take the injection, because I have not seen the material that I would need to tell you if it is safe or effective, or make your own decision because we're in a crisis, that is where the challenge is. So once you give an opinion like that, then there is somebody who is losing money. The question then is, how is it possible that such is happening in this day and time? And the idea is, the minute you declare a pandemic or you declare a disease of international health concern, it allows governments to start giving out money to vaccine manufacturers and to anybody who can help to come up with something that would be able to solve the crisis. It allows governments to remove money to contain the disease. It allows governments to remove money that was not budgeted for. And that is how money is made in the back end.
There's urgency.
The urgency. So that's how these things happen.
Okay.
So when you look at it from a doctor's perspective, and you now ask yourself from a medical point of view, is what we are doing right? Okay? Is it really okay to make such decisions or to give such advice? Then you come into headwinds and you end up with challenges.
Okay.
Yeah.
So let's touch on COVID a little bit. So COVID was there.
Yes.
According to you.
Yes.
It was there. So we took the wrong vaccines, or did we take the right vaccines?
You see, the question then is, what should we do if there is a disease outbreak? Okay? We are now having the story of monkeypox coming up. What should we do in a disease outbreak? This is a new disease. Nobody knows about it, all right? Nobody knows what COVID is except that people are dying, isn't it? That's where we all start. There are people dying off in China, they're just falling off and we don't know what is happening. Oh, now it is a respiratory disease, it is affecting the lungs. The first thing we want to see as doctors is the post-mortem reports of the people who have died.
Yes.
So anybody who dies, the doctors who are in that region go and dissect this body and look inside and determine what organs were affected, how were they affected, where is this virus causing most damage, and how is it causing the damage. That information is so critical because that's how you start planning on treatment. That's how you start planning on prevention. That's how you know which organ is being targeted. And then you can look at drugs that can be able to intervene. What were we advised by WHO about COVID deaths? Bury within 24 hours. Don't touch, no postmortem, just bury. That is totally unscientific because then it denies us the knowledge that we need to take care of the living. You get? So it is those kind of things that make you very worried. So there is something that is killing people. How is it killing people? Now, the other thing that came out clearly with time is that COVID was affecting the elderly. It was affecting people who were unwell. So the immune system is not very strong, okay? It was not affecting the young people and the children much. They were getting very mild infections. Then it also became clear that even if you looked at how it happened in Kenya here, it was more a disease of the elite. I don't know whether you realized.
Yes.
The people who are in informal settlements and people who are working out in the open up country were asking, were asking where is COVID. So one of the other things that came out early is that low vitamin D levels is a problem. Okay, so if you have very low vitamin D levels, then there is a big risk because your immunity is not good. So vitamin D is very important for immunity. And we get vitamin D from the sun for free. But you have to have at least some skin, bare skin exposed, and you're in the sun for maybe 30 minutes with a sleeveless shirt for you to get enough vitamin D for that day. So what was happening? Those of us who are going to work in the morning, you go to work before the sun is up. You leave the office, the sun is down. On Saturday, you want to hustle. On Sunday is a time to rest. How often are you in the sun for 30 minutes in a day? Okay? So if the people who are listening to this work like that and they have that kind of lifestyle, it's very important to go and just check what your vitamin D level is. Because if it is low, it is a crisis. Then we know vitamin C is very useful, especially for viral infections. Okay? So your fruit, the thing people call dawa in Kenya, ginger, honey, lemon, again, those are simple things that can help to boost natural immunity. There are some herbs and other things that we can take, our vegetables, that help us with the little things that we need to keep the immunity intact, isn't it? So it would have been possible then to say, since the elderly are being affected more, the people who are in old people's homes, the people who are in careers that don't allow them to be in the sun, vitamin D should have been promoted.
Yes.
Check your vitamin D level. If you can't check, take a supplement, find time to go into the sun and stuff like that. So again, that was missing. The other thing that was a big challenge is that we noticed that the oxygen levels were dropping very rapidly before somebody developed difficulty in breathing. WHO had said if you find you have flu, you have that runny nose, and you think you have COVID, or you have a test and it's positive, you isolate, and you only go to hospital when you develop difficulty in breathing. But by that time, the person's oxygen levels are 60s, are 70s, they're very low. So there was this little gadget that is called an oximeter. It doesn't cost much, okay? This is something that should have been made available to all health centers so that anybody who has those symptoms would easily go to the health center every day, just check your oxygen levels. If they are normal, then you can wait at home. If they start dropping, go to hospital before you develop difficulty in breathing, okay? Now, the other thing was that there are drugs. So we call it repurposing. So they are drugs that are made, say, for malaria. Okay, so you have hydroxychloroquine that was developed, say, for malaria. There is artemisia that artemisia is also an anti-malarial herb. Then we have ivermectin, which was developed for deworming.
Yes.
But then you go to literature and you find that people had seen that these drugs, when used in the laboratory against viruses, they seem to cause interfering with the way that respiratory virus was behaving. So this is known, like for COVID, it was known for SARS, the original SARS. Before this virus was SARS-CoV-2. It had been shown to have some effect against viruses.
Yes.
Now, when you read literature like that, and we are struggling to find a solution for this, and it's also a respiratory virus, then what we do in medicine is we repurpose drugs. So you take that which had been shown to be of benefit in the lab, or had been shown to be of benefit in small scale, and you give it to people because we are desperate. Okay? So you give it to people and you see whether it will help. Does it work? Why do you do that? Because these particular medicines have been found to be useful. And they have been used for 40 years or more and have been shown to be safe. So you already know the medicine. It's not something you're trying new. The only thing you're doing is taking that medicine that was used for something else and using it to treat the new condition. Now, what we found is that if you use those drugs, WHO would say they are not useful. Okay? Now, it is in the middle of a crisis. Even the vaccine you're telling us to give people is experimental. Nobody has ever used it before. And we want to use drugs that have been used and tested and are known to be safe. The only question is whether they would work against this disease or not. Between the two, which one would make more sense? An experimental vaccine or drugs that are safe that can be used to see whether they can cause a problem? So I can understand you saying we have an experimental vaccine and we have these drugs that have been found to be useful. Yes. Kindly use everything that you have so that we find if we can deal with this monster, isn't it? But once you start saying, don't use anything else except this one, then again there is a problem because you're interfering with my decision as a clinician. Yeah. I am supposed to be able to make independent decisions for my patient. Now, if you understand that COVID was multiplying within the first 7 to 10 days, and after that what was causing damage was the immune system, the virus is already gone, then you understand that the best time to give the antivirus medicine or anything that can stop the virus from multiplying is within the first week of treatment, isn't it, of disease. Yes. So if a person has a fever, they've done their test, is positive, that is the person who would then benefit from this. Yes. Now, when the international organizations heard about hydroxychloroquine and it was being used, they decided to do a trial to find out whether it is useful. Now, Lynn, what they did is that they gave hydroxychloroquine to patients who are already admitted in ICU. That is way beyond the 7 days. And they gave it in doses that were so high that we don't use them in normal practice. They were using doses that were higher than normal. And then they said hydroxychloroquine was causing heart conditions, heart challenges. And they said because of that trial, you can't use it. So they are playing around with science and they are playing around with people's minds because that's not how hydroxychloroquine was being used. Okay? For ivermectin, it was called a horse medicine, a dewormer. You know, how can you use a dewormer to treat a respiratory disease? And it was discredited. But when you look at literature, you find the communities that used it got better outcomes. So those are the challenges we're experiencing as clinicians, as doctors who are practicing medicine. And then there is somebody beyond us who is giving policies and directives that are counter to what we know to be useful to our patients. And when you voice this, then you become
an enemy.
an enemy.
Someone would ask a very innocent and maybe stupid question. So where did COVID go?
Well, the most likely thing that happened that was good is Omicron. Okay, so when the Omicron variant came, so the virus is mutating. Okay, whatever started as a disease is not what ended, you know, as your body fights it back, it changes a little.
Yes.
The virus also wants to survive. So what happens is that the virus that kills people very quickly then doesn't multiply itself. The virus that multiplies without killing then ends up being the dominant one that is around, okay? So when Omicron came, majority of the people in Kenya then got infected with Omicron. And once that happened, they developed immunity. And that's how COVID went away. So if you use isolation and lockdowns, you spread the disease, it continues to spread, but a little slower. If you don't intervene, it goes very rapid. Most of the population gets sick. Most of the population develops herd immunity, and the disease is gone, okay? And that's why even vaccines had never been used for an epidemic, an active disease. Because epidemics come and go, is after 2 or 3 years, 5 years, that if you find it remains and it is still killing many people, that you start thinking about a vaccine for it. It is not developed in advance. Yes, it is not developed like that. Then there is another thing from a medical perspective about that injection. And we agreed that a vaccine takes a part of the virus or the whole virus and then is used to create immunity, isn't it?
Yes.
Now, if this is the virus, these are all different proteins in the virus, including my palm, and you get this as the infection, then you develop immunity against each of these proteins, okay? And once you heal, then your body will be ready for this virus the next time. If I take this portion of the virus and I make a vaccine and I inject you with that, between the person who gets a portion and the person who gets a whole virus, who gets better immunity? You get? So the person who got infection and recovered has a stronger immunity than the one who got the portion, isn't it? What sense does it then make to say that if you already got COVID, you still need the vaccine? You see, from a scientific point of view, it doesn't make sense. You cannot make a vaccine if the body cannot respond to the disease. Now, if I have gotten the disease and recovered, why should I get the vaccine? Yet I would have better immunity than the person who got the vaccine. You get?
Yes.
Now, this is just a medical understanding of the disease. And so when you say that everybody, even those who have gotten sick, must get the vaccine, I have a problem as a doctor, because that doesn't make sense, okay? When you talk about herd immunity, when you have a large population of people who have gotten the antibodies, then the disease dies. So if I inject people and some people get sick, both communities contribute to herd immunity. So whether you got sick or whether you got injected, both of you contribute. So that thing of we are not safe until everybody is injected, again, doesn't make medical sense. You get?
Yes. We are not safe until everyone is injected.
Yes, that is a commercial term to sell vaccines. It is not a medical truth. The truth is that whether you got sick or whether you got vaccinated, everybody contributed to herd immunity.
Yes.
Okay? Now, let me ask you another question. If I have been vaccinated and this vaccine is effective, meaning I will either not get sick or get very mild disease, isn't it?
Yes.
I am protected, isn't it? Why should I care if you're not vaccinated? How do you threaten me?
No.
So why was it the people who were not vaccinated were the ones asked not to go to work? Where is the sense in that? Why would you tell me not to go to work if I am not vaccinated? Yet the fellows who want to be vaccinated have already received their vaccines and they're already protected. Because you see, when you come with an experimental drug, okay, and you put it here and we have COVID, then the options that you're giving me as a human being is you either take your chances with your immunity and any medication that might help you to heal from the disease, or you take your chances with the vaccine and its side effects, isn't it? That's the option we have, isn't it? Now, each one of us is an adult. Each one of us makes a decision. Somebody agrees to take the injection. Somebody decides not to take the injection. Why should you tell the one who has not taken the injection not to go to work? Unless what you want is for everybody to be injected. You start seeing the drift.
Yes.
So that the whole crisis was used to force people to be vaccinated, not to deal with the disease. If we are dealing with the disease, all of us should have had an opinion. But if only those who are promoting the injection have the right opinion, and anybody who is promoting prevention and treatment doesn't have an opinion, then you have an agenda. There is something you're up to. Now, let me just tell you the last bit. If this is a virus and it has a capsule of DNA or the messenger RNA, then you realize that what we are calling COVID injections, vaccines, are actually not a vaccine. From a medical perspective, this is actually a man-made virus. This is not a vaccine. I have created a capsule. Inside of it, I have put messenger RNA. And when this thing goes into your cells, it takes over your cell and it produces the spike proteins, which were the same things that were causing disease and were killing people in COVID-19. But they are now being produced inside of your body. All right? So now we are no longer using a portion of the virus. We are not using the dead virus. We are actually using an artificially created virus. So this is very different from the traditional vaccines that we have always known. It's a completely new science, is a completely new thing, and we are learning how it works and how it affects people. So we had been given two assurances. We had been told once you inject it here, it doesn't go beyond the muscle, all right? And we were told that the spike proteins your cells will produce will not leave that site, so that your body will learn how to deal with disease from that point, and then be able to take care of the rest of you. Both were found to be wrong.
But they're already inside us.
Yes. So it is going beyond where it was injected, meaning it is affecting other parts of your body, and other cells in your body would be producing spike proteins. And these spike proteins are not remaining where they were supposed to remain. They are also circulating, meaning if they go to other tissues, they will cause inflammation and cause disease. So when you understand this from a medical perspective, it makes you very, very angry that there was urgency to do this thing. There was suppression of any alternative that anybody could use. So the question is then, what is the game plan? What is this?
What's the end goal?
What's the end goal? The disease caused death. The injection caused death. What is the end goal? What is it that you're up to? Yes.
And now you get to answer. Yeah. But let's talk about HPV, because I know it touches on so many people.
Yes.
And one of the things I'm picking, you're saying, for us to be able to put something in us, the risk must be greater.
Yes.
Right?
Yes.
So, because I know a lot of people are tuning in because they want to know about HPV, the same way you've done with COVID, could you walk us through that and whether the risks have always been greater?
Okay, so to understand HPV, we must understand what it is we are trying to do. So the problem we are trying to solve is cancer of the cervix. And you must dissociate the two for it to make sense. So cancer of the cervix is the commonest cancer that is killing our women, especially in the developing countries. So it is a major concern. And the cancer of the cervix is associated with HPV in that if you have persistent HPV infection, then it can develop into cancer, all right? So you have a cancer whose cause or is associated with HPV, the infection. Now, these are the facts. over 90% of women, okay, who get HPV would destroy it using their natural immune system, and they will never know that they had the disease. HPV is one of the commonest sexually transmitted diseases. It is so common that we don't bother testing who has it, all right? And it has over 100 different subtypes. Most of them are innocent, okay? So it doesn't make sense to know who has HPV because it is so common. But we know that the minute you experience your first sexual experience, once you have your first sexual experience, then there is a possibility you may have gotten HPV, all right? Now, it is not HPV infection that's a problem. It is persistent HPV infection. So those women who get HPV and the immune system is not able to overcome it, and it remains in the mouth of the womb, which we call the cervix, it remains actively growing for 15 to 20 years without anybody knowing that the woman has it. That woman then has a risk of developing cancer. 15 to 20 years of unnoticed cervical inflammation or persistent HPV infection. So from a medical point of view, after understanding that, what we have always taught is any woman who has experienced sexual intercourse is then advised to have a HPV, a pap smear test done every 2 to 3 years. WHO in fact says every 5 to 10 years. But here we have always taught 2 to 3 years. Always do a pap smear test. The pap smear test is uncomfortable, but it's not supposed to be painful. We put in the speculum, we take a little secretion from the cervix, and that is looked at in the lab. And guess what, Lynn? You'd be able to detect changes of HPV that can lead to cancer 8 to 10 years before the cancer develops. Are we together? 8 to 10 years. You would find the persistent disease 8 to 10 years before the cancer. All right? And if you find persistent HPV and you give treatment for the cervical infection that may create issues, so there is no treatment for HPV, you then monitor this patient a little more closely. You do a pap smear every 6 months or 3 months or every 1 year, depending on how severe the inflammation was. Majority of them reverse. But if you find one who remains persistent, all right, then you do a very simple treatment of the cervix and you remove the areas that are infected. And once you do that, that woman no longer has a risk of cancer. All right? And that treatment is not expensive. All right? So as clinicians, as a doctor, my concern is not to eliminate HPV or eliminate cancer of the cervix because these are not practical targets. It doesn't make sense. But we can reduce or even eliminate death from cancer of the cervix. That is an attainable target, right? And how do we do this? By encouraging women to have a pap smear done every 2 to 3 years. Okay? So for me, I've solved my problem as a doctor. Do we have women having access to pap smear? Not everyone has access to pap smear. That then becomes the government initiative. How do we make sure the pap smear test is available to all women in the country? And for where we don't have pap smears, then there are simpler tests, that you use iodine or use acetoacetic acid that can help you to take biopsies of the areas that look suspicious, and then you can then treat that patient. So that is, if you ask me from a clinician's point of view or from a doctor's point of view, that is how I would deal with cancer of the cervix, okay? Regardless of how I know its relation with HPV. Now let's come back to HPV.
Yes.
We then create a vaccine, okay, against HPV. They are different, they are about 100, 150 different types. 2 types have been shown to be associated with about 70% of the conditions that lead to persistent HPV, okay? But there is 30% that are not in the vaccine. So the vaccine would will protect you against those two subtypes. Huh? So we have this vaccine that is available, all right? And it's supposed to be given to girls before they get sexually active. And in some countries, they're even giving it to boys, okay? Before they're sexually active, in the hope that they will develop immunity against those two subtypes. Yes. So you can see the theory. That's the theory. Now, because the vaccine has side effects, like all vaccines have, and if you watch a video that is called Sacrificial Virgins, you see mothers in the UK who were complaining about how their girls were injured because of those vaccines, and they were trying to seek justice. So it is not without side effects. And there will be one or two papers I've seen that has even shown girls having premature menopause because of the vaccine, okay? So these are things that mothers must understand. These are some of the conditions that can be caused by this vaccine, and therefore you are weighing them against the potential, the benefit of your child not getting this. Now, if the girl takes the vaccine, then as far as we know, she's protected for about 10 years.
Yes.
So she's taking it at 14. At 24, she's no longer protected. That's when she really needs it. I am making a decision for my daughter because she's underage, but from the age of 18, she can make a decision for herself and take that responsibility for herself. So if as a father, these are some of the concerns I must look at, then the question is, how would I advise my daughter? Yes? So HPV is a sexually transmitted disease. If you have not had sex, you have no risk of developing HPV. And if you decide to have sex, then you should understand that every 2 to 3 years, you need to do a pap smear so that you can detect those changes we talked about. But because 70% is what would be covered, 30% is not covered. Even if you get the injection, you must continue doing your pap smear every 2 to 3 years anyway, because you might be in the fraction that is still not protected. And if we are going to train our children to be protected against sexually transmitted diseases using vaccines, then we need to quickly develop one for gonorrhea, one for syphilis, one for HIV, one for chancroid, for all sexually transmitted diseases, because we've only protected her against one. Yes? So you can see that if you just take that understanding as a parent, and you understand that if my daughter is not sexually involved, she's not at risk. And if she is sexually involved, if she does her regular pap smear,
she'll be okay.
Will be able to find the disease and actually treat it. Then at that point, you have the right information to make a choice. Should I take the risks of the vaccine, or should I train my daughter or my son to take care of themselves against many other sexually transmitted diseases? And then parents can make a choice. Now, when you give that as an opinion, and you give this balanced information, and that you still need to do a pap smear even if you took that vaccine, all right? Because it doesn't protect you against everything. Then you're told you are making a mistake, that you're confusing people, and that you're telling people not to take vaccines, okay? To your old question of, am I an anti-vaxxer? Anti-vaxxers are described as people who are against vaccines.
Okay.
Okay? I have children, and they have all been vaccinated against the basic diseases that I feel the
risks are greater.
Yes, the risks are greater. I have a daughter, and I refused her to get the HPV, and I wrote a formal letter to the school not to vaccinate her. And as Catholic doctors, when we had a discussion with the Ministry of Health about this vaccine, initially it was being introduced as mandatory. It was going to be put in the general vaccination guidelines. And when we presented our case, and we were asked what would we accept as the bare minimum going forward, all we ask is that it is not made mandatory, all right? Let parents make a decision for themselves. But when you go to WHO, they have something they call the 90-70-90 initiative. The first 90 is that 90% of all children who are girls below the age of, I think, 10 or something, should be vaccinated. 90%. Then 70% screening, and then 90% to access treatment. When you give guidelines like those to the ministry, and the ministry passes down targets, then you now find community health workers required to make sure that certain number of girls are vaccinated. And you find headmasters bringing in people to schools to vaccinate the girls without even talking to the parents. That kind of thing is tyranny, and it must not be allowed. Parents must be respected. Human beings must be respected. Like I told you, I cannot love you enough to force you to take treatment. What I'm supposed to do is present to you the medical knowledge and information that you need to make an informed choice. That choice can be a consent, which says yes, or it can be a rejection of the treatment. We are not looking for informed consent. We are looking for informed choice. And the choice might be a consent or a rejection, and both must be respected.
All right. So where is the correlation in all this? Where is the correlation when it comes to infertility, miscarriages, early menopause? So as a woman, how does this, where is the correlation?
Well, I don't know whether it is by coincidence that almost everything that is being offered on large scale for the new diseases always seem to affect fertility. Is it by coincidence, or is it targeted? Maybe one day we'll find out. But one of the things that came out in the papers for COVID-19 that really hurt me was the fact that 80% or thereabouts of women who were pregnant within the first 3 months actually lost their pregnancies.
That was in the paper?
The trials, the clinical trials that were not released until 2 years later.
Yes.
And we had WHO recommend those injections to pregnant women. It really hurts. It really hurts. And it is so painful to have a small voice against such a big organization that has people everywhere who are on a salary, parroting and repeating the same message that WHO says. Yeah, so one of the other very painful experiences I had during the COVID time was one time I was asked a question in a relatives WhatsApp group, and I gave my medical opinion, and somebody posted that, but Bill Gates says this. Now, Bill Gates is an intelligent man. He's a good businessman. He has made a lot of money and he's extremely wealthy. But to weigh my medical opinion of 31 years with Bill Gates' opinion is really an insult. It is very, very sad that my opinion as a medical doctor can be weighed against the opinion of a medically lay person just because he's famous, all right? Now, there are other things that cause a lot of worry to a doctor like me. If the Secretary General, the Director General of the World Health Organization says that there's going to be another pandemic and it is going to be worse than the previous one, and it is not a matter of if, it is a matter of when, then he is telling me as a doctor, and he's telling everybody else in the world, he knows something that the rest of us do not know. And he's telling us there is going to be a pandemic, yes? And it's going to be worse than the previous one. If you are in the shoes of somebody with authority, wouldn't you want to interrogate this man and find out what is that he knows?
What do you know?
Yes, because if he knows that there is going to be a pandemic and he tells us where it is going to come from, then we can stop it. Why is it that the whole world is being threatened? And that is what we were told about COVID, and it happened. Yes? And now we are being told again, so it means something will happen. Viruses don't wake up one day and decide to infect human beings. That's not how it works. So when we come to monkeypox, for instance, monkeypox has been there. It is now it's being called mpox. I don't know who is supposed to not to annoy whether you call it monkeypox or mpox.
Mpox.
It doesn't matter.
Mpox,
whatever. It has always been there. If you read the papers that first described it, I think it was in Germany or one of those European countries, in 1959-58, you find pictures of people handling those monkeys with bare hands. It was not infecting human beings, all right? It was only infecting the monkeys. And 50%, when they examined the monkeys, they found that 50% of them had the lesions, but never showed the disease, which means they healed naturally and nobody knew they were sick, all right? Now, we then are told there is a crisis in the Congo, right? And it is spreading from animals to human beings, okay? And you can understand that when we discussed immunity, isn't it?
Yes.
So if I'm a hunter and I go hunting an animal and I kill it and I have been bruised by thorns or something, or I've cut myself with my blade, and that stuff gets into me, you can understand how it can transmit to a human being. But it was not transmitting between human beings, all right? Now, the next time we hear about it is 2022, 2023. This time it has appeared in Europe, and it is amongst men who use the rectum to masturbate. So there are men who are using the rectum as a masturbatory agent, and they are spreading disease among themselves. But it was not spreading to other people.
Yes.
We then had one of the principal vaccine investigators in the country called Professor Anzala. He gave us a talk as doctors about monkeypox, and now there is the question of whether it also transmits through the respiratory route, okay? Now, WHO has already declared it a disease of international concern, which means now governments can start putting away money in readiness to fight the disease. There is already talk about vaccines that are available. Professor Anzala took us through those, the vaccines that are available, that had been developed because of the 2022-2023 crisis.
Yes.
So the thing is, could this be what we are being told to prepare for? Now, when you go back to COVID-19, it is now clear that it is not a natural virus. So there is what is called gain of function research. And Lynn, this is just madness. That scientists are given money to take a virus that is found in an animal and to tweak it and modify it so that it can infect human beings. Just in case somebody ever did that and produced a bioweapon, and then you produce a vaccine just in case this kind of virus ever was released. Okay, that's what is called gain of function research. Is very scary stuff. And if we know that there is gain of function research that is happening, and then the Secretary General Director General of World Health Organization is warning us about a disease that is coming, you see, you must take him seriously, because there must be something that he knows that we don't know.
And he's the pro in this.
Yes. Now, as a government, as an African continent, what should then be our response? It should be that gain of function research should be stopped. There should be a moratorium, and it should never, ever happen again. Because the minute you allow it to happen, people will keep creating new diseases so that they can sell their drugs. And we'll keep getting into crisis after crisis after crisis, okay? So these are the things that you see, and you want to ask yourself some questions, and you ask, what can we do? But if there's anything that we can do, if there's anything our governments can do, the first thing Africa must demand is that all gain of function research is stopped and should never happen again, just like people did for the nuclear armament thing. And if you have any of those viruses, then destroy them, okay? The other thing that is of great concern is that one of the vaccines they are talking about, so we celebrated the end of smallpox.
Yes.
And the smallpox was so dangerous that the vaccine that was made for smallpox actually used cowpox, because the smallpox virus was too dangerous to use to create infection. But if you use cowpox, then the immune system would also fight against chickenpox. And we celebrated that there is no more chickenpox. I mean smallpox. There is no more smallpox. Now, if you look at the WHO website and go and look for a picture of smallpox, the way it used to appear, you can't tell it apart from monkeypox unless you do a DNA analysis. And both viruses are alive. Now, if you use a vaccine that has live smallpox, it means that you can recreate that disease again. Because if you inject me with that, then I'll get chickenpox, isn't it? If it is the actual virus, ideally, if you put a small dose, I'll get a mild infection. But it means I'll actually have smallpox. I'll actually have smallpox. And smallpox can then spread. So as a clinician, I'd be very worried if anybody used live smallpox viruses in any vaccine that they are proposing to use, because that in itself can actually trigger a smallpox pandemic.
So are we saying this whole mpox is a big pharma way of making more money?
You see, this is something that you would have to deduce. Okay, nobody has written it anywhere.
Yes.
But think about it this way. If I can take a virus and make it infective to human beings, and then make something that can protect people from that disease, and then that disease actually happens to appear, and it is declared an international health concern, and governments can now put away money. So I have this vaccine, but I don't have enough money to produce enough for the whole world, isn't it? And since it's a world thing, give me money to make more, isn't it? And then once it is ready, then give me money to distribute it to wherever it's supposed to go. So you can see there is a commercial angle to it. Now, if we made money that way with COVID, why would we not create another virus? And why would we not create another one after this one? So the thing is that there is no way it is written. But if you keep an open mind and you look around you, you're left with many, many, many questions. Because like I told you, from a medical point of view, my business is to prevent illness and treat people who are sick. When it comes to using a vaccine, I'm creating a mild infection so as to protect you from the actual disease. So the disease that I'm using to protect you cannot be worse than the disease that I'm trying to prevent in the first place. You get? So even if the old vaccine was there for smallpox and it is still available today, the question is, for it to be produced in large quantities, there is need for money. And there must be an enough threat for that to be done. Then how do you dispense this medicine after you have made it? Unless you put restrictions. You can't go to the office unless you have this. You can't go here unless you have this. You can't shake hands. You can't do this. You can't do that.
Flight, you can't travel. You can't do this unless you have this.
Yes. And once you put those restrictions, then people go and line up. Okay. Now, if you scare people enough and tell them there is no medicine, this thing is going to kill you, this thing, psychologically you torture people and prepare them to take. Yes. So there is a lot of stuff that you look from outside that has no medical value, but it is very prominent in the way things are done.
And it appears forced.
Yes.
Do this.
Yes.
And a lot of fear also.
If doctors do not take their place and protect the general population from the greed of big pharma and other people who are making drugs for profit, then the general population cannot protect itself. We must bring back medical ethics into the decisions on how to manage the disease and how to treat the disease, the clinician must be listened to. The management of disease cannot be the issue about public health officers. Even those of us who treat disease should be listened to and asked, what is your contribution towards this, so that we are all. And for the general population, give them everything that they need to hear. This is a disease. If somebody has gotten monkeypox and has died, do a post-mortem for us. Tell us what killed that person. What was the immunity like? Were they healthy people? What was their age? What organs did you find damaged? So that we can start thinking about how to come up with treatment options for some of these things.
Our politicians are aware of these things, because I'm watching you give this talk in front of Museveni, and he goes and says, thank you so much for educating me, right? Does it mean they are not aware? Does it mean they are not involved? Does it mean they do not know what's going on and what their role should be?
Well, at the level of the presidency, you would imagine that there are a lot of things that would happen, that the person in that office would not be technically, would not understand technically. And therefore you must rely on technical people. So in this country, the director of health, he's called the Director General of Health, is the chief advisor of the president. And he's the chief advisor of the Cabinet Secretary of Health. So he's really the technical person in health, okay? Now, when a crisis comes, the Director General of Health is supposed to put together a team of experts. And depending on who he chooses to be on his team, then he may get one kind of advice or another. And if WHO operatives are the majority in this team, then of course WHO policy and interventions will be the majority, isn't it? Now, if the Director General is not strong enough to open up his borders and go to people who are in the trenches treating people and asking them, what have you had? What have you learned? What can you bring to the table? Then everything that will happen will be very closed, all right? So the person advising the president would basically be a very important person. Now, if that person is not open-minded, or has a bias towards a certain narrative, then it compromises everything that we can do as doctors in the country. Yeah.
So it's, but I'm just thinking maybe they should be involved more. I mean, it's
Well,
a vaccine, it's a national disaster, it's this and this.
You see, Lynn, when you think about it logically, you come to the same conclusion I have. Why is it that it is wrong to speak your mind? Why is it that it is wrong to question? All right? Because the things I have said here are the same things, I especially about HPV, are the same things I told President Museveni. And soon after that, there was a document that was released, signed by the WHO, UNICEF, the Ministry of Health in that place. And they actually wrote down and called me an anti-vaxxer. In fact, they say anti-vaxxer Wahome, all right? These are very insolent terms, and these are people who are playing around with the reputation of others. And they have a platform that is bigger than mine, and they can actually badmouth someone. The question is, why would I continue to speak? Is because I am here for a reason, okay? And I have this burden in my heart that I need to do things the way they are supposed to be done. And it is the cross that I must carry. The cross that I must carry for my love of family, that I must carry for the love of this country, that I must carry for the love of humanity. And if we, as doctors, do not stand in that gap, then medicine will be used to terrorize people and to take away their freedoms and to take away the sovereignty of countries. Yes.
Doesn't it scare you? Because Dr. Sebi was here. So many people have been here. And doesn't it scare you?
Well, the thing is that we have been told in my faith not to fear the one who would kill the body, and to be afraid of the one who would kill both the body and the soul. And that there is life after this one. And the question that I'll be asked is, what did you do with the talents that I gave you? Being a medical doctor is one of the talents I have been given. It must be for the benefit of people. It cannot be for my benefit. And if I don't use that talent that way, then I will never have peace, all right? So for my own peace of mind, for the safety of my patients and the safety of others, then my life is not of greater value. So there is a risk. It is very clear that it is there. We have seen people who have taken this position being destroyed financially, being destroyed from a professional point of view. If you work in the US or in Europe, they take away your professorship, they take away your funding, you know, and basically they can totally destroy you. But then if I don't, who will?
What are some of the sources? Where can people find some of this data? Where can people reference?
Well, the general websites would probably not give you adequate information. So you'd have to look for sources that hold that opinion if you are to find that issue. But if you Google body defense or immunity, you see how the body defends itself. If you Google what is a virus, you see it's a little membrane with DNA material. You'll understand what it is we are discussing. If you Google monkeypox, if you Google gain of function research, if you Google the positions of WHO in as far as managing some of these conditions, you'll be able to see all these things. So it's not a particular website. It's really just sieving through the information that is out there.
Where our natural remedies, you know, our herbs, our plants. I've seen people who are very vocal, people like Americs are always telling us to plant our indigenous, you know, seeds. Where does it all come to play when it comes to curing some of these things that we suffer from? And how do the experts receive this?
So the places of herbs is nutritional. Your body needs various ingredients, various nutrients for its defense mechanism to remain active. So most of those herbal things and vegetables give you those things that boost your immunity. Now, boosting your immunity is more productive than not taking care of your health and waiting to fall sick. Because even when you come to the treatment, then we can only help if your immune system is also helping. Okay, so if somebody's immune system has collapsed, I can't help them as a doctor. They will die of flu, they will die of anything if the immune system is collapsed. So that is where those things fall in. Now, remember that most of the treatments that we use are of herbal origin, okay? Quinine, for instance, which is one of the examples I was giving, that we use to treat even resistant malaria, comes from the bark of a tree. So somebody takes the bark of a tree, goes and refines, removes the quinine, and then packages that, and then it is sold as medicine. All right. Artemisia is another plant that is used for treating malaria. Okay. So you take the Artemisia plant. It has like 10 different ingredients that can fight malaria. We extract one, powder it, make it into a product. So remember, for you to sell, for you to have a patent, it can't be the natural product. So you must take the natural product, tweak it a bit, produce it industrially, and then you're able to use it and sell it for profit. So like what I was telling people in that example is when the demand for Artemisia increased, because China was producing most of it and consuming 80%, there was very little to send outside. So when the other world understood the value of Artemisia, because China has used it for centuries to treat malaria, when they understood the value and wanted to commercialize, the question was, can it grow anywhere else? So people took the plant around. Here in Kenya, it was given to farmers in different parts of the country. They went to Uganda, they went to Congo, they went to Madagascar, and it was encouraged to be grown in large numbers. So the plantations, some of the largest ones, are in Congo, right? So these villagers are planting this Artemisia. You cut it, you dry it, you put it in sacks, and you export it. And when it is made into drugs and it comes back into the country, you can't afford to buy the drug to treat your malaria. Okay? So what they started doing is taking this stuff and boiling it and making tea. And they discovered they were getting cured.
Better.
They were getting better. So this young man called Dr. Jerome, is actually a doctor, goes and decides he's going to do a study to check the efficacy of this herb against the medication. And he says, just so that nobody has doubt, he's going to use WHO standards. And he did what is called a double-blind study. And in a double-blind study, the patient and the person administering the drug don't know who is taking the drug and who is taking the placebo. So he had placebo tea, he had tea made of that stuff, and then he had people who were taking the actual treatment. And he was able to demonstrate that that boiled herb, just boiled in water,
just boiling it,
just boil, yes, was actually treating malaria, and even treating it more efficiently than the commercial drug. And he published this paper from, I think, 2015 or thereabouts. It was eventually published in 2018 or 2019. Within 2 years, the paper was retracted. It was removed. So if you Google it, Artemisia versus artemisinin, you'll find the paper, but it is written, retracted. Okay? And this is because of commercial interests. Now, you can imagine if one of the commonest causes of malaria, one of the commonest cause of death is malaria, and you have herbs like those that people can drink and get better because they are what produce the original drug anyway. And then you have little plants, flowers, and other plants that you can plant around the house that repel insects, including mosquitoes, so that by just planting that Artemisia tree around the compound, actually you reduce the number of mosquitoes in your compound, which would reduce the risk. So the question then is, if Africa says this is something we'd want to try to reduce the burden of malaria, why would somebody come and say don't do that? And why would somebody say that I am promoting traditional medicine instead of vaccines? But the thing is, from a clinical point of view, present all these things to people. We have herbalists. The other day they were in the papers and they were showing they have herbs that can treat cancer when they were celebrating their World Herbal Day. And the government would give money to such establishments to test those drugs and see what is effective, what is not. And that would be within the means of Africa. If we can use something like that to eliminate malaria in Africa, why not? Why would anybody tell us not to? Why would anybody insist on drugs that are manufactured, drugs that have a patent, drugs that we have to pay for at a high cost? You see, for me as a doctor, whether the Artemisia comes as a tablet or as a herb, the understanding is that it destroys malaria and it cures the patient, okay? So the only thing I would insist on is the pharmaceutical industry in Kenya looks at it, determines what dose is right, what can be used, can it be used in pregnant women, can it be used in children? There is mechanisms of deciding those doses and stuff so that it is made safe, isn't it? Then why not? You understand? So the thing is that if Africa is allowed to think for itself and to come up with alternatives for treating what it has, and its technical people are allowed to think within the restraints of what is available to me, then it is possible for us to deal with a lot of problems.
Someone would ask, where then is the voice of our professors, our experts, people who should be leading Africa? Where is their voice in all this? Because it appears that Africa is being controlled from somewhere that is not Africa. So where is the voice of our experts in all this, our African professors?
It is the money. Where is the money? So if the governments in Africa will not put aside money for research, then it will never happen from internally. If those who give professors money to do research are wired towards making sure we use certain things, then it is those kind of papers that will be many.
Yeah.
Because it is the funding agency that helps to produce literature, isn't it?
Yes.
So if our best brains are employed by WHO, our best brains are employed by the CDC Africa, if our best brains are employed by these organizations that are funded externally, then every direction they take will be of the person who pays the piper.
Hey.
Yes, so that's the challenge. If Africa is to develop itself, then it needs to start putting money
Fund itself.
to fund itself. If you look at the AU and you look at the World Health Organization, there were member organizations, so that the majority of the money was paid by members, and then the members had a say. Now, very few African countries put in their money into those organizations. So those people who fund the organization then get to call the shots, isn't it?
Yes.
Yes, so it is about prioritizing. Now, if you go a little deeper and you find that people with commercial interest in Africa also know the power of being able to have a say in government, then you also want to go and find out who is funding your politicians, who is funding your political parties, and what are their interests. Because again, if I am interested in GMOs being legalized in the country, and there is a certain presidential candidate and a certain party that is willing to put this in its narrative, and they have assured me they are going to change the law to allow GMOs to be planted, then I'll put my money into that candidate. I'll put my money into that political party. And the minute they go in there, the first thing I will ask is, before the end of the year, here is my bill, have it sorted out, keep your part of the bargain.
Yes.
Right? So for me, other than the gain of research, demanding that the gain of function research is stopped, the next thing we must do, especially as Kenyans, is to understand that Article 101 of the Constitution changed everything in 2010. We have politicians who still live in the old dispensation, where the presidency and the state are the power. 2010, it changed. And what Gen Z was able to demonstrate is that the people can actually take power, isn't it? That Article 101 of the Constitution, where we are the sovereign and the politicians are our servants, and they're supposed to do what we ask. And if they have an idea, to share it for us to participate in public participation. That is where the issue is. Kenyans must stop looking for a savior. Each one of us must engage actively. And there are two very important people in our politics, and that's the MCA and the MP. For far too long, we spent too much time on the governor and the presidency. But our representatives are the MP and the MCA. Those are the people who should be our voice in parliament. Those are the people who vet everybody who is appointed to senior positions, including judges, including the head of the police, including everyone. Those are the people who are passing the law. The finance bill was not passed by the president. It was passed by members of parliament, regardless of what Kenyans were saying. 2027 may be the last election we have to make a difference in this country. That we must actively seek out from amongst ourselves people who are of high moral standing and put those people into public office. It is not about youth, it is not about age, it is not about tribe, it is not about religion. It is about integrity. That is the leader we must look for. That headmaster in the village who did a good job with the high school and then is standing for MP, and we don't vote for him because some rich guy came and gave us money.
Yes.
That is where we are making the mistake. That thing of voting for a suit, because we are looking at the presidential candidate, everybody below here we vote for, has to stop. It must be this MCA or that one. What do they stand for? And how do we know them? They must be locals who we have seen, the way they treat their family, the way they run their businesses, that we look for people of high integrity. If we do not do that, and government is enslaved by people who give it money, we shall forever be in this crisis.
Yes.
Yeah.
I'm in agreement. Thank you so much. But as we wind up, few things. What are 2 books you would recommend our audience to read? And also, what's your future for Africa? What's your hope for Africa?
There is a book by Steve Biko. It was written about Steve Biko. Cry My Beloved Country or something. I think that's what it was called. It's the life of Steve Biko. And it's a very powerful book. Cry Freedom. Cry Freedom, that's the term. And Cry Freedom was written about the life of Steve Biko. And it had a very powerful effect on my life because he says, this child has been brought up in the ghettos of South Africa. They understand that to be life, and it is normal for them until the day they are old enough to go and work in the white-owned areas. And they go and see people who live differently from them, and they begin to feel there is something wrong about me. So 2 problems we have in humanity is superiority complex, that some people think they are more important than others, an inferiority complex, where the African people feel they are not as good as everybody else. So that book is very nice, and it would help to guide people. The other book that might be important is a book that is written by WHO. It's called Sexual Health, Human Rights, and the Law. That book is written to explain about sexual and reproductive health and rights. The depopulation agenda has been collapsed into that thing called sexual and reproductive health and rights. And the sexual health and rights put together then means that in law, what your country has accepted is that abortion will be legalized, that you will allow same-sex marriages, that you will allow the teaching of homosexuality and transgenderism, that you will allow children to access contraceptives without parental authority, that abortion is human right, all right, and that the children can be taught all this stuff in comprehensive sexuality education. Now, when you look at the UNFPA website, United Nations Population Fund, which is the one that was started to deal with population issues, today it calls itself the Sexual Health, the Sexual and Reproductive Health Arm of the UN. So its agenda is sexual and reproductive health and rights. When you look at SDGs, you find sexual and reproductive health and rights. When you go to commercial contracts we are supposed to sign with the other countries, you find some of the requirements are that we introduce sexual and reproductive health and rights. And when that thing is brought, it destroys the family. And once you destroy the family, then population will go down on its own. You don't have to work very hard.
That's it.
Yes. So if you understand that, then you understand why the term sexual and reproductive health and rights should make your hair stand up like you have seen the devil, and why you must not allow it in any policy documents in any country that cares for its children.
All right. Your hope for Africa?
My hope for Africa is based on one, WHO passed the international health regulations. They are trying to change them to give more power to the secretary, to the director general, to declare those pandemics and be able to So the WHO is the one that's guiding the world on how to manage pandemics. Now, they passed something in June of this year, but they broke their own laws because Article 55.2, I think, of the International Health Regulations say that anything that is to be adopted during the assembly of the World Health Organization must be presented to the member countries at least 4 months, 3 or 4 months before the meeting, so that each one of those countries is able to discuss this thing with its people, all right? So that if there is anything they pass that changes how WHO should manage the next pandemic, it has to wait until next year before it is ratified. During that window, all Africans must put pressure on their governments to scrutinize those proposals and reject any proposals that takes away the rights of the people in their countries and gives it to WHO. So for me, there is hope for Africa, and we have a lot of resources. Africa is very wealthy. If we could just understand we are as good as everybody else, and that if we take charge of our destiny and use the brains of our youth who are energetic and they have all this energy and knowledge, and we have invested heavily in training them, and give them the opportunities to use their talents, Africa would actually be the next frontier. Yeah.
It is actually the next frontier. Thank you so much. We'll say like Museveni for opening our eyes, for educating us. I believe one conversation at a time. I'm a huge fan of having these conversations. We don't all have to agree, but it's very important for us to dig deeper.
Yes.
It shouldn't be just what we've been told.
Yes.
What do we know? And why do we rely so much on what we've been told?
Yes.
What do we know? And what should we know?
True.
That is going to, you know, affect the way we live our lives. But thank you so much for coming. Where can people find you? Where can people connect with you?
My clinic is in Cardinal Otunga Plaza Annex. We are on 6th floor. It's called Mercy Medical Center.
Yeah.
I run a team with 2 other doctors. It's purely for gynecological issues. So we've dedicated our lives to looking after the woman and the family. Yes.
Looks like it's working. Thank you so much, Dr. Wahome, and to you guys at home. I keep saying, honestly, my intention with this show is for us to be able to pick something and go and ask ourselves the hard questions. We must not just rely, again, on what we've been told. It's very important, whether we agree or disagree, it's very important for us to be able to write things down and learn to question the reality as we've been told. But as always, really interested in your feedback on the comment section. I value your feedback. It's where I honestly get a lot of ideas on what to do next. Those people who even come on my email and they recommend, Dr. Wahome comes very highly recommended. So I would urge you to watch and then comment whether we agree or disagree. It's still a conversation worth having. And again, if you are not able to leave your feedback on the comment section, info@lnn.digital, that's where you can be able to find me. And when you're at it, let me know who else would you like to see on the seat, and also what are some of these conversations that you think we must have before it's too late. You know, my name is Lynn Ngugi. See you maybe tomorrow, 10 a.m. or 7 p.m. Bye-bye.